I think there's something we ought to really understand about the Class Act. It did have a short-term impact, according to the way that the Congressional Budget Office, quote, scores things, tells us how much things will add or detract from the deficit, either plus or minus. And the fact is that the Class Act in the first 10 years, because younger people would be paying in premiums and had not gone to the point where they were eligible for the benefits, it disguised the cost of what we know now, what we call Obamacare. I know of no one in this body who is opposed to a viable, reasonable, fiscally sound long-term care program. This is not it.
Here we are 19 months or so later. The Department of Health and Human Services has concluded that this doesn't work. They can't make it work. And now the CBO has come out and said, okay, it really doesn't impact the budget. I think we ought to acknowledge what now everybody concludes to be the case, and that is that this program won't work. It is actuarially unsound, and we ought to repeal it. We ought to get it off the books, and that was simply what my motion would do.
Senator Thune has deserved a lot of credit for pursuing this issue tenaciously and seeing his prediction validated now by President Obama's own secretary that this can't be a viable program. But you are exactly correct. One of the greatest financial misrepresentations in history, if it continues to be on the books, will be the contention that this health care bill would actually create money for the United States Treasury, actually produce a surplus. And they used a 10-year scoring model, $70 billion, about 60% or so of the total savings this bill is alleged to produce, not savings, actual revenue, net revenue increase, was this program. And now it's gone.
The people who actually are responsible for doing the math on this came up and said that they called the class program a recipe for disaster, and those were in internal emails that we discovered when we were doing this investigation.
It's these kind of gimmicks that might keep somebody from being prosecuted and sent to jail if they were a private person that ought to end in the Congress. I think the American people are crying out for honesty in budgeting. They want us to be responsible, to tell them the good news, but to tell them the bad news financially that we face. And that they know we can't do things that we'd like to do if we don't have the money. And they know we don't have the money to keep taking on new obligations. So I just feel like that this is not healthy. Now, when Secretary Sebelius came along and had to certify that they had a 75-year actuarially sound program, no way she could do it. And it was just knocks a gaping hole into the entire scheme of this health care bill. And so I think it's a lesson for all of us on every vote we do. We need to be sure that we are honest not only in the short-term window, but in the long term also.
So the American people realize that we need truth, honesty in budgeting. And I know my colleague from the Budget Committee is working on that, has had an op-ed that I read, has a proposal, working on that. That's what the American people want. They want some honesty in budgeting, not the kind of politics and budget gimmicks and tricks that we see happening here. And the American people are tired of being misled and sold a bill of goods. They see through it, they don't like it, they don't want it, and that's why all of the polling on the health care law shows it at an all-time low.
I hope we learn something throughout our whole budgetary and financial process here. We can't continue to play games with the American people's money. We've got to be honest with them. Honest about our budget, honest about what things are going to cost, and only then can we get the country on a sound footing.